Histamine, pharmacological actions and clinical significance. A 24-year-old woman receives an antibiotic injection. Within minutes, she develops intense itching, widespread urticaria, swelling of the lips, wheezing, and a sudden fall in blood pressure. How can a single chemical mediator produce effects across so many organs simultaneously? The answer is histamine, a powerful autacoid with widespread actions throughout the body. What is histamine? Histamine is a biogenic amine and a powerful autacoid or local hormone that acts through four G protein coupled receptors H1, H2, H3, and H4. Each receptor has characteristic functions. H1 receptors are particularly important in allergy and smooth muscle responses. H2 receptors play a major role in gastric acid secretion. H3 receptors are mainly involved in histamine's actions as a CNS neurotransmitter, while H4 receptors participate primarily in immune modulation. Pharmacological actions. Cardiovascular effects. Histamine causes vasodilation through both H1 and H2 receptors, which reduces peripheral vascular resistance and produces a fall in blood pressure. This may also trigger reflex tachycardia. Activation of H1 receptors increases capillary permeability, allowing fluid to escape into the tissues and causing edema. In the skin, histamine produces the characteristic triple response: wheal, flare, and erythema. These vascular actions become particularly important when histamine is released massively during severe allergic reactions. Pharmacological actions. Smooth muscle, gastric, and other effects. Through H1 receptor activation, histamine causes contraction of bronchial and intestinal smooth muscle. The resulting bronchoconstriction is particularly important in asthmatic patients. In the stomach, histamine activates H2 receptors on parietal cells, stimulating gastric acid secretion. This provides the pharmacological basis for using H2 blockers in peptic ulcer disease. Histamine also stimulates sensory nerve endings, producing itching and pain. In the CNS, it acts as a neurotransmitter involved in maintaining wakefulness and alertness. Clinical significance. Allergic reactions. Histamine is a major mediator of type 1 hypersensitivity, contributing to conditions such as allergic rhinitis, urticaria or hives, and angioedema. Its actions on sensory nerves and blood vessels produce itching and urticaria, while its effects on bronchial smooth muscle can contribute to bronchospasm. Extensive vasodilation may also contribute to hypotension. H1 antihistamines are particularly useful for relieving histamine-mediated symptoms such as itching and urticaria. Clinical significance. Anaphylaxis. Massive histamine release causes severe vasodilation, shock, and bronchoconstriction. Antihistamines address skin symptoms, but adrenaline is the life-saving treatment, reversing bronchospasm and restoring blood pressure. Clinical significance. Bronchial asthma and peptic ulcer disease. Histamine contributes to bronchospasm via H1 receptors, making it a key trigger in asthmatic patients. H2 receptor stimulation on parietal cells drives gastric acid secretion, the target of H2 blockers, for example, ranitidine, famotidine. Clinical significance. Drug therapy. The actions of histamine also provide the basis for two important groups of drugs: H1 blockers, and H2 blockers. H1 blockers are used mainly for allergic conditions such as allergic rhinitis, urticaria or hives, and angioedema. Common examples include cetirizine and loratadine. In contrast, H2 blockers reduce histamine-mediated gastric acid secretion and are used in peptic ulcer disease, GERD, and other conditions requiring gastric acid suppression. Examples include ranitidine and famotidine. Key takeaways. To summarize, there are 4 key takeaways about histamine. First, histamine acts through 4 receptors, H1 to H4, producing widespread cardiovascular, smooth muscle, gastric, sensory, and CNS effects. Second, histamine is a major mediator of type 1 hypersensitivity, contributing to itching, urticaria, bronchospasm, and hypotension. Third, in anaphylaxis, antihistamines can help control skin symptoms, but adrenaline is the essential life-saving treatment for anaphylactic shock. Finally, these actions provide important clinical drug targets. H1 blockers are used mainly for allergic disorders, while H2 blockers reduce gastric acid secretion and are used in acid peptic disease.